If you're dealing with joint pain, muscle soreness, or lingering inflammation, you've probably reached for over-the-counter NSAIDs or non-steroidal anti-inflammatories like ibuprofen or naproxen. But long-term use of these drugs can increase the risk of stomach ulcers, kidney issues, and even cardiovascular problems. So what if I told you there are some natural options, some botanical medicines and enzymes with strong anti-inflammatory benefits and fewer side effects? In this video, I'll walk you through 4 evidence-backed natural remedies that you can help relieve pain and inflammation without the long-term risks of NSAIDs. Hey, I'm Dr. Jason Barker. For 23 years, I've helped athletes boost performance, recover faster, and stay injury-free. And as an athlete myself, I want to share some science-backed strategies on training, recovery, supplements, and natural medicines to help you stay strong, healthy, and performing at your best. Let's start with the most well-known, turmeric, specifically its active compound, curcumin. Curcumin has been shown to inhibit multiple inflammatory pathways, including NF-kappa beta and COX-2, the same enzymatic pathways that are targeted by many NSAIDs. In a 2014 randomized trial published in Clinical Interventions in Aging, researchers found that 1,500 milligrams of curcumin daily was just as effective as 1,200 milligrams of ibuprofen for relieving pain in patients with knee osteoarthritis without the GI side effects. Curcumin is notoriously poorly absorbed, so look for supplements that contain liposomal delivery, piperine from black pepper, or phytosome forms like Meriva to improve its bioavailability. Next up is Boswellia serrata, also known as Indian frankincense. Boswellia contains compounds called boswellic acids, which inhibit the 5-lipoxygenase pathway, a key enzymatic pathway in the inflammatory cascade that NSAIDs don't always hit. In a 2008 study published in Arthritis Research and Therapy, patients with osteoarthritis who took 100 milligrams of enriched boswellia extract daily experienced significant reductions in pain and improved joint function within just 7 days. This makes boswellia especially promising for people with joint inflammation, and it tends to be well tolerated over time. Another lesser known but powerful herb is devil's claw or Harpagophytum procumbens, traditionally used for muscle and joint pain. Its active compounds, harpagosides, have been shown to reduce both pro-inflammatory cytokines and that COX-2 activity. A 2003 study in rheumatology found that devil's claw extract reduced pain and improved mobility in people with osteoarthritis, with results comparable to a prescription anti-inflammatory. Typical dosing is around 600 to 1,000 milligrams a day of standardized extract. Let's finish with a combo, ginger and systemic enzymes. Ginger contains gingerols and shogals, which block inflammatory prostaglandins and leukotrienes. A meta-analysis from Osteoarthritis and Cartilage in 2015 concluded that ginger extract modestly but significantly reduced pain in people with osteoarthritis. When paired with proteolytic enzymes like serrapeptase, bromelain, and rutin, this combo gets even stronger. These enzymes work by breaking down fibrin, cellular debris, and other inflammatory compounds in the bloodstream, thereby enhancing circulation and speeding up tissue repair. A 2004 study in Medical Science Monitor showed that patients taking proteolytic enzymes after surgery had less swelling and faster recovery compared to those taking NSAIDs. One important note, if you're using enzymes like serrapeptase or protease to reduce inflammation, make sure to take them on an empty stomach. That means at least 30 to 60 minutes before eating or 2 hours after a meal. Taken with food, they'll just help digest that meal. But on an empty stomach, they can pass directly into your bloodstream, where they go to work breaking down that fibrin, cellular debris, and other inflammatory byproducts. So this isn't just theory. Studies have shown that these enzymes are absorbed systemically into the bloodstream, so timing really does matter here. So if you're looking for a more natural, sustainable approach to pain and inflammation, these herbs and enzymes offer a promising path, one that's backed by both traditional use and some modern science. Of course, supplements should always be part of a bigger plan, dialing in your diet, movement, and other recovery routines. And before starting anything new, especially if you're already on medications, definitely check in with your healthcare provider who's knowledgeable about botanical medicines and enzymes. I'll include links to some of these high-quality, clinically dosed formulas that we recommend over at thenaturathletesclinic.com in the description down below, and also the links to the studies I mentioned here as well. Thanks for watching, and here's to some pain-free movement naturally. I'll see you in the next video.